In this video, what I'd like to do is to discuss a myth that's being perpetrated throughout our society. It's alive and well, and it's dealing with osteoporosis. And many of the people believe that the osteoporosis is due to a deficiency of Fosamax, Evista, Actonel, or Boniva, or the best way to resolve it is just to take 1,000 to 1,500 milligrams of calcium, and that couldn't be further from the truth. What we've got to understand is that the human body is fearfully and wonderfully made, and it's constantly regenerating and repairing itself. That's true of bone. As the bone breaks down, it will actually start to repair and replenish itself. And that's true not only of the bone, as I said, but of all the tissues of the body. And when you're taking these types of drugs, you're not getting a bona fide rebuild of the bone. You're getting something that's artificial and unnatural, and it's very, very damaging, to say the least. What's happening is that when the bone is being broken down and you're replacing it with one of these drugs, the outlook is not very good. As a matter of fact, I'm certain that most of you are unaware that at best, you can only get from taking these drugs about a 2% improvement in the quality of the bone, and over just a few years before it plateaus or starts to diminish. Only 2% improvement by taking this. That's not good at all. But what's even worse is you're opening up the door to something very terrible that's happening to your body. Because for every action, there's always an equal and opposite reaction. And in the instance of this, when you lose the bone mineral, what's happening now is that heavy metals, very toxic heavy metals, are now being absorbed into the formation of the new bone. And that really concerns me. It's an issue for all of our patients that come to our center, as a matter of fact. It's one of the areas we look at because of the fact that so many people are on these drugs. Now, one of the most noxious, one of the most dangerous of all the toxic heavy metals is cadmium. The cadmium now has an affinity for bone, and it's going into the bone and it's replacing the minerals that should be there. It's a toxic heavy metal, and as it does that, it's pushing the zinc out of the bone. Now, we'll talk about that in just a few moments. But the cadmium now has an affinity for bone. It also is absorbed into the kidney and can result in high blood pressure and or kidney failure. Also, as far as the heart is concerned, it goes into the coronary blood vessels, resulting in coronary artery disease and or cardiomyopathy, which is damage and destruction of the muscles that make up the heart. And into the lungs, it results in emphysema. So this is nothing that we should take lightly. And it's a result of putting these chemicals in our body instead of looking to the cause and trying to identify what that is. As we go on now, I mentioned earlier that the cadmium will now displace the zinc. Now, for many people, when they think about zinc, they think about taking it for a cold or a fever or whatever. But I want to share with you that zinc is critically important in the human body and is responsible for the formation of over 200 different enzymes, which are of paramount importance to the body. So this is what's happening now. As the zinc is being depleted out of the bone, the cadmium is increasing, and as the cadmium is increasing, more and more zinc is being pushed out. And this gives rise to the osteopenia, osteomalacia, easily fracturing the bones, and or osteoporosis, which is why most people started to take these drugs in the first place, was to prevent something that they're actually causing to happen to their body. So with this being said, many individuals will go to their doctor, and their doctor will say, well, yes, you do have osteoporosis, so I'm going to recommend that you take 1,000 to 1,500 milligrams of calcium. Well, as good as that sounds, that's not a good idea either, because most of the calcium that people are taking over the counter is basically garbage. It's a very cheap grade. It can't be assimilated by the body, and it's not used. And that which does get used or absorbed into the bone, now that type of calcium displaces even more zinc, which opens up the door to even more cadmium being stored into the bone. Now, as I said, this calcium can't be assimilated or absorbed by the body, utilized by it. So what happens is these minerals are now floating around the body, and they result in hardened arteries of the brain and of the heart. I'm telling you, folks, this is terrible. So you may ask yourself, well, what do you do if you're one of these individuals who are on these drugs? My first recommendation is go to your doctor or see a physician that will do an RBC, intracellular nutrient and toxic heavy metal profile on you. That way you can see the level of the zinc, you can see if you have absorbed these heavy metals, and if you have, then you can take action in order to clear it out of your body. You need to find a doctor that does that. That's what we do for all of our patients that are coming in that have these types of issues. Because what we want to do is not throw something at a condition, but rather find out and identify the cause. Because, folks, when you find the cause, usually the solution presents itself. And what we want to do for our patients is always offer them the best performance of their life. Isn't that the responsibility of all doctors? Well, I hope this has been beneficial to you. And if you are, as I said, one of these individuals that's on one of these drugs, it would behoove you having a discussion, a heart-to-heart, with your prescribing physician. Once again, I want to thank you for viewing this video. And until the next time, God bless.